My name is Anissa Mitchell with PMD Alliance. Today, we're going to be talking about taking control of your Parkinson's journey with StrivePD and how this can support your care. So you guys probably have been watching just the blow up of technology, AI, all the different apps that's available. And we are now starting to leverage those to help manage symptoms, to identify things that's going on, help you manage your medications, to improve your activity level, to give you prompts for that. And so we are going to be talking today about StrivePD and how they can help you optimize your care and your quality of life. So we have actually two folks from StrivePD that are going to be working or talking to us today. And this program is actually in partnership with Rune Labs, who brings StrivePD to you. And thanks for the shout out from Palm Desert. Hi, Dee. If everyone wants to give us a shout out, we obviously want to know where you're from. We like hearing from our folks. So please drop that in the chat. And also, that's where your questions will be. So once the presentation is done, then we will come back to those questions and we'll keep track of those as you guys are listening to the presentation today. So I want to introduce our speakers. With this is Amanda Hare. She is a doctorate level nurse practitioner. She is the lead medical science liaison at Rune Labs. She provides clinical training and education to movement disorder specialists to ensure Rune Lab technology is improved to help with people's quality of life. And prior to I can't talk today. Prior to joining Rune Labs, she worked at the Medical University of South Carolina, where she worked directly with movement disorders patients and has 13 years of clinical nursing experience and expertise. And recently, she was certified in movement disorders with our new certification for movement disorders for advanced practice providers. Our other speaker is Brianna Hood. She is also a doctorate level physical therapist. She is both LSVT Big certified and Rock Steady Boxing coach and has a lot of clinical experience with Parkinson's in a variety of clinical settings. She joined Rune Labs back in 2022. She's a member of the StrivePD clinical specialist team. Day to day, she works closely with clinicians to use StrivePD, providing support and educational resources and assists with the updates of the product around mobility metrics and exercise activity logging. So that is important information. So I'm going to pass it over to Amanda and Brianna.
Hi, thank you so much for that introduction. I'm going to go ahead and share our slideshow and we'll get started. The slides will be available via a PDF to all of you afterwards. So no need to take too many notes. So you'll get all of this information afterwards. Let me make sure I'm sharing my screen here. Give me 1 second. Okay, can I just get like a thumbs up or a head nod? All right, perfect. Okay, oops, let's go to the slideshow. Okay, so as already said, we are Rune Labs and our product that we have is StrivePD. The original creation of StrivePD happened with this lovely lady here. This is Aura. Aura has Parkinson's herself. She's been diagnosed since 2011. She had a lot of issues and a lot of concerns surrounding her medications. She had a lot of side effects, a lot of fluctuations. So she found that she was constantly writing down in notebooks all of her symptoms, keeping spreadsheets of when she takes her medication and when other things were occurring, other kinds of symptoms, to try and find some patterns and correlations and bring all this to her doctor's appointments. Eventually, she started finding that that was a lot to handle and take care of, especially since your appointments sometimes are 6 months apart, sometimes a year apart with your movement disorder specialist. It's a lot of information to have to catalog on your own. So she decided to make an app called StrivePD, where she could input all that information in one place and be able to see those correlations of her information. So she named it StrivePD. In 2018, we acquired this from Aura. We did a big revamp. We've added so many features and new pieces to the app. But ARA is still part of our patient advisory board. So we do have a patient advisory board, all people with Parkinson's. We do have them test out all of our features, give us input and feedback about everything, because our mission is to not just be a tech company, but to be a health care tech company and a care companion to people with Parkinson's. So there's no better source than going to the people who do live day to day with Parkinson's to let us know if we are doing a good job with our app. So that is the story of how we came about. So I am calling this an app, but let me get this little okay out of the way up here. I'm calling this an app, but we are really a care companion. So we are here to help you with your day-to-day life and be able to bring all of the symptoms, all of the exercise, all of the medications, everything that's going on day to day into one place for you and for your care team. This can allow you to, track your symptoms over time, see how you're doing with a new medication that you just started. Maybe you just started a new exercise plan and you want to see the effect it has on your symptoms. This can all be done in our app. Our app is completely free. There is one stipulation. It is only for iPhones and Apple Watches. So unfortunately, if you are an Android user, at this time, it is not available for Android phones. So it is in the Apple App Store, but you do have to have an Apple product to be able to download it. That being said, the Apple Watch is also another important feature of StrivePD. You don't have to have an Apple Watch in order to use StrivePD. You can just have the phone. But the Apple Watch received FDA 510(k) clearance back in 2021, I believe it is, to track two things for people with Parkinson's. It will automatically track your tremors and your dyskinesia just by wearing it. So just wearing the watch every day, those two symptoms will be tracked. You'll be able to see how much time of tremor you have every day. And that can be really valuable. Like I said, with medication changes or with exercise changes, you can start to see the effects of how those changes improved your symptoms. Another thing that we just recently added to our app is also clinical trials. You'll be notified of different clinical trials around your area and if you're eligible for them. And Amanda's going to go into a bit more detail about that in a later slide. Yeah, there we go. All right, so like I said, the Apple Watch will automatically, without doing anything, just wearing the watch, will automatically track your tremors and your dyskinesia. You can learn from your patterns and behavior to manage your conditions. You can improve your communication with your care team. I'll get into another slide where we talk about reports that automatically get sent to your email that you can print out or forward along to your family or to your caregivers, or bring to your appointments to show your clinicians, this is what my tremor looks like, this is what my data looks like, to make better informed decisions about your care. And then again, we can help you participate in the IRB-approved clinical trials for Parkinson's. So like I said, we are only available for iPhones at this time, and they are compatible. StrivePD is compatible with the iPhone SE, second generation or newer, and the Apple Watch Series 5 or newer. I think they're up to like an Apple Watch 12 or 13. So the 5 is a pretty old one. So that still works with our app. That's no problem. It's just when it starts to get too old, like an Apple Watch 2 or 3, the software updates won't happen on the watch, and therefore our app won't function properly on the watch. So an Apple Watch 5 or more recent, iPhone SE second generation or more recent. Here are some screenshots of what the app looks like. Again, it's completely free to download and to use it. You can see in the first screen there, this is what we call a daily check-in, where you can just check in to see how you're feeling each day. And it brings you to that nice calendar view, so you can maybe pick up on some patterns. Green is a good day, yellow is a meh day, and red is a bad day. So you can start to see maybe every Thursday you're having a bad day. Why is that happening? And you can start to realize why your symptoms are worse that day. Your tremor and dyskinesia data will show up in a nice chart like this throughout the day. So you can see what times it tends to spike. Maybe if your medication's wearing off a bit early or you skipped a medication dose, you notice you have a spike in your tremor at that time. Any exercise that you put into the app as well will show up on this chart. So you can see, maybe you did Rock City Boxing in the morning and you notice that your tremor's a lot better in the evening because you exercised that day. So we talk a lot about data, and the data that we take is from 3 different buckets for StrivePD. The first bucket there is the number 1, the Apple Health Kit data. So if you do have an iPhone, there is an app on your iPhone. It comes with your phone automatically. It's called the Health app, and it's white with a pink little heart on it. This collects a lot of data that we will then take and put into StrivePD, so it can be all in one place for you. It will take sleep data. If you have an Apple Watch and you sleep with your Apple Watch on, it will let you know how many hours of sleep you get, how often you wake up through the night, REM sleep, deep sleep, and gives that nice breakdown. The iPhone, not the watch, but the phone, when it's in your pocket, it will actually collect your step length, your walking speed, and something called double support percentage, which is like how balanced you are during the gait cycle. So we take that information. Activity, it will record, the Apple Watch will record activity. Sometimes automatically, it can sense your heart rate's going up and will ask you, are you working out? And you can say yes and record your workout. Or you can use the workout app and record that you're doing an exercise or going for a walk. And then lastly, heart rate metrics. The Apple Watch automatically records your heart rate, and we've been utilizing that during the exercise phase as well to help you pick the best exercises that are going to enhance and improve your symptoms the most. So I'll get a little more into that. The second bucket is the Apple Movement Disorder Kit. This is what makes our app unique to others. This is what got that FDA clearance. So this is the Apple Watch, the ability for the Apple Watch to collect tremor and dyskinesia data passively for you. And then the last one is patient self-reported data. So in the app, you can also report things manually. You can log that you had a headache or you're having constipation for 2 days in a row. You can start to log those things manually, and that will all be collected, as well as your medication schedule. You can just put the medication schedule in once, and then the phone and or the watch will give you alerts when it's time to take your next dose of medicine. So that's very helpful for compliance as well with your medication schedule. Here are a few more little screenshots of what it looks like in our app. We have this nice, what we like to call a toolbox of what do you want to log. So like I said, you can put symptoms or side effects in there, like headaches, dizziness, low blood pressure, really anything that you're experiencing as a symptom or side effect of your PD. Your medication schedule you can input. Influences, so that's things like activity, sleep, different types of food, like maybe you had a high protein meal and you notice that your medication doesn't kick in as well when you eat a lot of protein. Even things like stress. I always say this as an example. There was a gentleman whose mother-in-law, whenever she came to town, he noticed that the watch was picking up a lot of tremor. His tremor went through the roof because that was a stress to him. And having his mother-in-law around was just not helpful for his tremors. I would not tell his mother-in-law that, but it's a good thing to start to notice some patterns of what's going on with your tremors and dyskinesia. Lastly is or not second to last, is the DBS. We are in no way connected to your DBS, but you can log what your group is or what setting that you have your DBS on each day if you would like. And then there's also notes. So you can just put in any notes that you want. You can use voice text as well. So if you find that you are having a day that your tremor is really acting up and you don't feel like typing or you just dislike typing on the keyboard, which I completely understand, you can use your voice as well to dictate notes into the app. we'll get a little bit more into the exercise component as well. This is clearly my favorite, being a physical therapist and a Rocksteady boxing coach. We do know how important exercise is for the PD population. So we wanted to make sure that we really emphasize that in our app as well and connect you to that. So within the app, there is this exercise card. You can see here it says 16-day streak. And what that means is this person exercised for 16 days in a row. So it will keep track. Some people get very competitive with their Rocksteady boxing class of how many days in a row they can go with their exercise. You can log all different ones. And again, you can do it from the watch. So it will automatically go in after your workout. You won't have to go back into the phone to relog it. It will happen from the watch. Or if you don't have a watch, you can just manually log it in the phone as well. We also have here weekly active minutes, and it's 150 is what your goal is to get to each week. And I'll get a little into why that is, why we picked that number. Like I said, that exercise will show up in your tremor and your dyskinesia charts. So you'll be able to see the correlation between the days that you exercise and then how those symptoms like tremor react. So for some individuals, right after intense exercise, their tremor starts to go up, and that's normal. But then they'll realize that later in the day, their tremor's a lot lower than it usually is day to day. So it's a nice way to be able to start to see this objective information right in front of you. So if you keep up on the research or look on any of a Parkinson's related site, you've probably seen some information about how intense exercise has become a very hot topic. So right now, exercise is the only disease modifying therapy out there to help to actually slow the progression of Parkinson's. There has been a lot of research. And it's not just any old exercise. Going for a walk around the block is very nice, and it's great for you as well. But they find that if you get your heart rate to 70% or higher of your heart rate max, that has the most benefit for slowing down the progression of the disease. Not to get too much into the weeds about it, but basically, when your heart rate gets to that level during exercise, you get a chemical released in your brain called BDNF, and that helps with a lot of different functions of the brain, and that's why it can really help your motor symptoms and your non-motor symptoms, and again, be a little neuroprotective of the brain. So due to this research and this current literature, we wanted to make sure that it was reflected in our app. So 150 minutes of exercise per week, because that is the recommendation from the Parkinson's Foundation and the American College of Sports Medicine. And then of that 150 minutes, 90 minutes should be considered moderate to vigorous. So we're calling that the StrivePD Zone 3 Plus. That shows up in the app as well, so you can see what exercises are getting you to that heart rate. Now, again, this is if you have an Apple Watch, because the Apple Watch brings that heart rate data into our app. So as you can see here, this individual has 108 minutes this week, and 57 of them have been in that high heart rate range, really helping them to get that release of BDNF in their brain and really help with that neuroprotective factor. So again, StrivePD, we're trying to be unique, not just a general exercise app for you, because we are catering to the specifics of what people with Parkinson's should be doing. Yep. So again, this is to help, adhere to some clinically meaningful exercise regimens, educate and engage you. So there's lots of drop downs where you can see different information about types of exercise. There's link outs to different articles, like from the Davis Phinney Foundation or the Parkinson's Foundation, so you can become more educated on different types of exercise to try and why they are important. Each exercise you can also look at and be able to see the breakdown of the zones. So see when you're in that zone 3 plus or higher. And that can be beneficial so you know which exercises tend to get you to that high heart rate. Another great thing about StrivePD is every month, automatically, you will get sent a report. This report will have all of your data from StrivePD synthesized into a really nice PDF. This PDF you can print out, you can forward it along, you can bring it to your appointments with your care team, with your PT, with your speech therapist, and it just gives a breakdown of everything collected from the Apple Watch, including your tremor and dyskinesia. It will give you a breakdown of your mobility metrics, so like your walking speed, your step length. It will give you information about all the symptoms that you've been logging, so pain or headaches or constipation. So it's a really nice summary. It compares the most recent month to the month prior. So you can also start to compare how well you're doing, if you're improving since last month, or maybe some things didn't go so well this month. Maybe you started a new medication and you're trying to see the effect over the month of how that medication has helped your symptoms. So it's a really, really important piece of data that's given to you every single month, or I should say multiple pieces of data given to you every single month that you can bring to your care team and use for yourself as well. So here's some little screenshots of what the report looks like each month, information from your watch, different highlights to point out, and then your activity as well, so you can see throughout the month how your activity was compared to last month. All right, and now I'm going to hand it over to Amanda, who's going to talk about our clinical trials.
Thanks, Bree. Lots of exciting things. So we'll try not to overwhelm you more. But clinical trials is something I think is very much needed. So we know that there are, 1 million+ patients with Parkinson's, and only about 3% participate in research. And so I think one of the big barriers is getting that information. So sometimes, if you're not going to an academic center, you may not know what clinical trials are, you know, at your service or at your location. All of the clinical sites differ. So some academic centers may have one trial, but other areas may have another. So what StrivePD really would like to do is link you to clinical trials that best fit your needs. So are you newly diagnosed? Do you have greater than 3 hours of off time? Are you specifically looking for a clinical trial because you just got genetic testing and were told that you had the LRRK2 gene? So we want to make sure that we are getting you all of this knowledge so that A, you know what trials are out there. B, you know exactly where those trials are. And C, you have, the opportunity to discuss with a clinical site coordinator whether that would be a good opportunity for you or not. So the more we can get these clinical trials going, the more medication, more options, and really, hopefully, the first disease modifying therapy to slow the progression down. So some of you may have gotten a notification today. So we're constantly getting new and updated trials that we will send out a message to see if you're interested in hearing more. So we are all over the place, which is great. We have over 260 clinicians that have partnered with us, that we have trained and spoken to, and that are using StrivePD in their practice for multiple different reasons. There are 150 clinical sites, and we have over 11,000 users now. We would love to have more and more users and make this app as user-friendly. And we really love the feedback that each individual can give to us, because we know that every patient with Parkinson's is different, and we want our toolbox to make sure that we have all the necessary tools that can help you in your day to day, and then to prepare for your visits, like Bree was talking about. So this was particularly interesting to Rune Labs, and we decided we really wanted to do a pilot around this information. So this year alone, 4 out of every 12 people with Parkinson's will be hospitalized. 3 of the 4 will not get the right medicine on time, and 2 of the 3 will have complications as a result. So we know that going to the emergency room, going to the ER, They're wanting you to stay in bed. They potentially may be giving you medicines that you really shouldn't have with Parkinson's that block dopamine. Could be a nausea medicine, it could be an anxiety medicine. And so we know that sometimes those medicines worsen Parkinson's symptoms. And also, when you're not getting your medications on time, it can be not a fun roller coaster of symptoms. They're not well managed. So we really wanted to figure out, how can we keep people out of the hospital and out of the ER using StrivePD? So what we did is we partnered with Kaiser Permanente, and we had an overall goal to improve patient and clinician care delivery experience through using StrivePD with coaching and a triage management system. So everyone used the StrivePD app, but we kicked it up a notch. We really tried to put that personalized touch and that white glove service to good use. And in all of these interventions, education, one-on-one Zoom calls, coaching sessions, we had a 9-month study. Now it's over a year. And we looked at 139 Parkinson's patients on StrivePD versus not on StrivePD. And we found that 75% of patients reported StrivePD being helpful in medication adherence. So we know that medications can be given 2, 3, 4, even 5 times a day. These are really hard to keep up with, especially, you take that morning medicine, you take the night medicine, but it's those in-betweens when you're at Rock Steady Boxing or you're at the grocery store where you just get off track. And so a little buzz and a little outreach has been really helpful. 74% of patients reported an increase in activity after onboarding. So just like Bree was showing you, active minutes and where you're getting your heart rate zone, all of that I think are very motivating factors, because when patients come in to see me, sometimes they say, well, what kind of exercise should I do? Should I walk? Should I run? Should I do jumping jacks? Should I do rock steady boxing? Does LSVT big get my heart rate in the right zone? This is where the app can guide you and help you understand, walks are great, but for those 90 minutes of vigorous exercise, maybe rock steady boxing is what gets you in that zone. And then 52% increased their exercise time to above the recommended 150 minutes. So we love to see that. There were also 67% of patients that reported events which may require attention. So if someone had a fall or maybe they had new onset hallucinations, we had a triage process for them to hopefully, instead of having to go to the ER, maybe they could get in with their, nurse practitioner or primary care doctor to get an x-ray or potentially check a urinalysis to make sure there's not an infection. And our most popular feature in the app is just free text. So in the app, you can write anything and everything. You can treat it as a journal. So a lot of people reported certain events. They traveled and they felt like in the mountain air and hiking, they did so much better when they were on vacation. Or maybe they had an event where they had to get their appendix out, and so they wanted to document that in StrivePD so that when they're getting their monthly reports, they can remember to share that with their clinician at their next visit. So the biggest thing out of all of this is we saw almost half the amount of ER visits before, pre and post. So when people started using StrivePD, this specific cohort reduced 42.9%, so 43%. And some people were feeling even good enough to cancel their appointment. They felt like they were taking their meds on time, their care plan was optimized, they were exercising, and things were going well, and they didn't feel like they needed that visit. They could, push it back an extra 3 months. So we really looked at high-risk individuals and identified certain algorithm and really tried to intervene before, anything that would happen that would send you to the ER. So StrivePD Guardian is something that then came out of this pilot with Kaiser. And we thought, okay, Kaiser patients are really lucky, right? We're doing this pilot with them. They're getting all this extra attention and care from us. What about other people that maybe aren't connected to a Kaiser system. And so StrivePD Guardian was basically thought of as a subscription-based Parkinson's care for anybody living with Parkinson's. And so we know that Parkinson's is hard to manage alone, that things happen one day to the next, that there's no pattern, there's no correlation, and it's can be overwhelming. And so we wanted to give back to everyone what we were giving to these Kaiser pilot patients. So we really wanted to help beef up all of the knowledge and all of the things that you need to talk about with your clinician instead of, kind of going in and saying, I'm not really sure, I think I'm doing okay, but then having a list where you could compare and you could really see your top symptoms. So we want to personalize this guidance where we can give you that white glove service. So this is a subscription-based service that is $600 a year. Again, this is only on the Apple iPhone and watch. And, we pair you with a dedicated health coach that can really offer insights and support in this unique journey. So we know every journey is unique, and we want to offer that real-time support, optimize your care, help you with the medications, and help you prepare for doctor's visits, ahead of time. So with StrivePD Guardian, again, you're going to get that live personalized onboarding where we go over and help you set up the app. So some people have some difficulties with technology. We are fine to take an hour to walk you through how to set that up. And then we have coaching sessions where in between visits or after visits, we can get on and give you this expert support and guidance around what your progress is and what your care goals are. And then also really giving you that preparedness for your next visit to help you guide your session with your clinician. Sometimes you only have 15-20 minutes to get out everything that's happened over the last 6 months. So we can help organize and synthesize that for you so that your top needs are being discussed. And then risk monitoring, we're also looking at what patterns are changing. Are things getting worse? What would require an attention? Like, is your mobility metrics, starting to decline? Should you do physical therapy? So we are trying to keep track of those metrics to help you plan ahead before there is a fall. So if you are interested in StrivePD, you can download it from the QR code. It is a free app, and it's all of the things that Bree just showed you. If you feel like you want that white glove personalized coaching session service, that's where you would sign up for StrivePD Guardian, and we would love to support you in any way that we can.
I'd also just want to add that if you are thinking about Guardian, but you would like to know more information, we do have a separate website for Guardian. So strivepd.com/Guardian, where you can find more information about that subscription-based product offering. But like Amanda said, if you want to try out StrivePD, the free version, again, it's in the app, and you can scan that first QR code there with the number 1 next to it.
Thank you. I do have some questions that came in while you guys were talking. So the first one was, when or will you have this available for Android users in the future?
I can take that one, Amanda. So right now, we do not have a roadmap for Android use of StrivePD. There's a few reasons for that. One of them, and probably the most important, is that at this time, Apple has that MM4PD data. So that is that data from the Apple Watch for tremor and dyskinesia, being able to detect that, and that has an FDA clearance to it as well. At this time, there is no other company that we are aware of, so Google or the Oura Ring or Fitbits or any other of those wearable devices that have that technology and have FDA clearance of that technology. So right now we are tied to Apple specifically for that reason.
Awesome. Well, that answered another question about the beach band, so thank you for explaining that. We also had a question about whether this would be helpful for someone who has essential tremor.
Yeah, so all of our algorithms and all of our validations are around Parkinson's tremor. So when you have essential tremor, that's more of an action tremor when you're writing or drinking or holding something like a plate. And that tremor is with action. The Parkinson's tremor is at rest. So the Apple Watch, the algorithm is detected to pick up that rest tremor. So it is not currently validated for essential tremor.
And then there was a question, can you measure blood pressure? If not, is that being worked on, perhaps wearing a special wristband?
Yeah, I would love for it to measure blood pressure. I know there are some apps out there that do that. I'm not sure how accurate or how you calibrate that. That is something that we have heard multiple times. We know there is that, orthostatic hypotension where your blood pressure can drop when you stand up, and it would be really nice to kind of have an easy way to detect that while you're out and about. That is something we're looking into right now. We don't have that technology, but we will definitely bring that feedback to our product team because we do hear that quite a bit. So thank you.
Absolutely. And then this person said or asked, so there's no need to actually log exercise if they're using their Apple workout selection. So it will automatically transfer to Strive PD.
Yes, and that was feedback that we got from users like all of you, who said, it's really annoying that I'm using Apple to log my workouts and that I have to then go into StrivePD and log it again. So we do listen and we did make that adjustment, and we're able to integrate anything from the Apple workout app and from the watch to bring it right into StrivePD to save you time and not have to relog everything.
Awesome. And then this person said that they're currently working with the Parkinson's Voice Project and wants to know if daily voice and speech exercises can be recorded by Strive PD.
So this is very exciting and something that I hope in the future we will be able to do. We do have a partnership with LSVT Global. So right now you can log your LSVT big exercise in our app manually, just inputting in the activity section. However, we don't have voice at this time. We are looking to just be able to log that you did your voice exercises. But when it comes to actually speaking into the app and using that kind of technology to see how well you're doing, if you're improving your voice, if you're performing your exercises correctly, we have not started that process yet, but that's something that we have been very interested in seeing how we could integrate that into our app. Our app does work with Siri, and there are some other technologies out there with the voice transcription and being able to show that kind of improvement or decline in voice for populations like Parkinson's. So that's something on our radar, and we hope in the future to be able to integrate, because we do know how important the speech language pathology aspect is as well.
Absolutely. And then someone wanted to know for your Guardian program, you mentioned the health coach. What background do the health coaches have? What kind of clinician are they? And are they specially certified or aware of Parkinson's?
Yeah, so a health coach is someone that is trained just in health coaching and guidance. So they are not a clinician, they're not a nurse practitioner, they're not a physician's assistant or a movement disorder specialist. They are trained in health coaching. So this is not medical advice. Unfortunately, we would have to be licensed in all 50 states because all 50 states have different regulations regarding what a nurse practitioner is able to do versus a physician's assistant. um, so we would love to be a medical advice service, but we cannot. So what we try to do is coach you through your health plan. So for instance, if your clinician was talking to you about drinking more water for constipation and those things weren't helpful, we can guide you to things that are not medical advice. So we wouldn't recommend that you take 20 milligrams of a certain medication, but we could help you with, over-the-counter Miralax or getting more movement, or potentially, eating more fiber, using Benefiber, things like that. So they do have a health coaching service certification, but they are not a clinician. So all of that will stay with the clinician that you're with, all that medical advice. We wouldn't ask you to change any of your medications, go up on the dose, down on the dose. This would just be coaching around, where is the next, Rock Steady boxing closest to me? Or, how do I get into LSVT big? Do I need a referral? Or, I've been having a lot of anxiety that I've never had before. Is this typical with Parkinson's? Maybe someone's newly diagnosed and they said, well, they didn't even do a test on me. How could they diagnose me? We could kind of coach you through the clinical diagnosis and potentially other objective measures like a DAT scan or a skin biopsy that could help with the diagnosis.
And thanks for clarifying that. And then also, does the StrivePD app need to be installed on your watch as well as your iPhone?
If your iPhone is connected to your Apple Watch, it will, when you download it onto your phone from the App Store, it will automatically download onto your watch as well.
The fact that it goes all the way back to the Apple Watch 5 is really helpful because, some of us have older watches. So that's wonderful to know. Any other questions for Brianna or Amanda from anyone? I think we've gone through what we had so far. This has been really helpful. I love all of the things. Your free version offers so much. Like there's just so much involved in that. That's amazing.
Thank you. Yeah, we're adding more and more. The more feedback, the more we can add on. We welcome any and all feedback.
Awesome. And so Donna raised her hand. If you can type in your chat your question, we would love to be able to answer that for you. And in the meantime, I will just remind everyone that the slides will be available, and also you can go back and watch this, especially if you want to share it with somebody who might benefit from this information, please do. So this person wants to know, do you collect user data and how secure is it?
That's a great question. We do collect it in order to display it on your app as well as display it into those monthly reports that we send to you. We are HIPAA compliant. So we have a very intense security team. We have something called high trust certification, which is a very difficult thing to get because we do work with pharmaceutical companies and clinical trials. So we do have to be extremely secure with all of our data. So yes, we are HIPAA compliant and high trust certified.
Donna wanted to know, do you list on your website which movement disorder specialists have really integrated Strive information and has integrated the patient record?
We do not currently. We would love to have that information. Right now, some clinicians have access to the portal, and some clinicians like the reports that you bring in. So, there are clinicians that are very busy. They don't have time to log onto a portal to kind of download and look at your information. So, any of those monthly reports that you can bring in and kind of help guide your clinician. Some of them prefer that versus, others prefer to dig in that data and kind of really follow, like if they just started you on the new, pump, let's see how you've done over the last week on a day-to-day basis and get very granular versus some clinicians want that long-term visibility of, let's see how your walking has changed over the last 2 years, or maybe you newly started levodopa and we look back 2 years ago because you've had an iPhone and all these mobility metrics have been captured. We look back to see, how was your, progress of, walking speed, double support percentage, how was that trending? And then how did that change after you started levodopa? So clinicians are very much different in the sense of how they want to use StrivePD. But yeah, we don't have a list. We're kind of all over. And if your physician doesn't know about StrivePD, bring in your reports, let them see kind of what they would like for you to bring in for them. And that seems to be the best option to kind of keep them on time for their visits.
Question if you can use this on an Apple Watch without an iPhone. Do you have to have both?
Yes, and that is not due to StrivePD. You cannot use an Apple Watch in general unless you have it connected to an iPhone. Unfortunately, it does not work with an iPad either. You can download StrivePD onto your iPad, absolutely. Some people like to do that as well as have it on their phone and watch, because having it on the iPad, you have that bigger screen, and sometimes that's a little bit nicer to work with if you're putting a lot of information in manually. But in Apple Watch will only connect to an iPhone. It will not connect to an iPad or to any kind of Apple computer. It has to be the iPhone.
There are no workarounds with just getting the watch.
And
Okay.
I also like to always say, Amanda's probably going to laugh, we are in no way connected to Apple financially. So I know we always talk about the Apple Watch and how great it is to have. You know, there's fall detection. There's other parts of the Apple Watch that are just great use for day-to-day life and for safety. You know, it will detect a fall, a hard fall automatically, and that's Apple's technology. That's not ours. Automatically will detect your fall. It will send your coordinates out to the local EMS to find you if you don't respond to the fall alert. It will also contact all of your emergency contacts to let them know that you had a fall. So it's somewhat like a life alert, which is really nice. But we do not, we've had so many users or so many people come to us and buy iPhones and Apple Watches strictly to use with StrivePD, which is amazing to hear. We do not get any profit from Apple, unfortunately. I really wish we did, because we are such, you know, cheerleaders for the use of Apple products. But I will say the Apple Watch is very game changing. You know, I think there's a lot of benefits for using it besides just StrivePD. But of course, StrivePD is a great reason why as well.
Hopefully. And thank you for Cliff. And then somebody wanted to know if systems are updated, do you get notification? Like if you, you know, do an update.
An update to our app. So for the most part, in your settings, you can have it automatically update. So your app will just automatically update, and usually it doesn't give you a notification or anything. You just may go into the app one day and notice that some features look a little different. Sometimes we do have a little pop-up that happens the first time you go into the app after an update happens to let you know, hey, you know, check this out. This is something new that you can look at, and gives you like a little description of what is new. Sometimes there is an update that's just more behind the scenes, some like bug fixes and things like that. So you wouldn't be necessarily notified of that. But yes, if there's a big new feature, we will notify you, as well as about 4 times a year, we have a StrivePD support group that we run. We're actually doing it tomorrow. And it usually will be an hour long of us going over any kind of new features that were released in that past 4 months and how to use them, and really get into the nitty-gritty detail about those new features. So keep a lookout for that as well. We like to post about that StrivePD support group.
It's awesome that you guys offer that. So I wondered if you could just do, for everyone's benefit, because you've talked about so many things today, a quick recap of what symptoms the health app will track automatically, which ones they would have to enter manually, just so that we can refresh everyone's mind before we end up the program.
Yeah, so automatically tremor and dyskinesia are captured by the watch. Mobility metrics are all captured from the iPhone. So making sure that you keep your iPhone in your pocket or at hip level is really good to help capture the most accurate measurements. Again, you can record your workouts in the Apple Health Kit through the watch, and those will go right onto StrivePD. You also can go to sleep with the watch on, and it can help you track your sleep. It does not go into, you know, the different stages of sleep quite yet, but it can kind of give you a pattern over a certain time. If you're having early morning awakenings, or maybe you're not getting great sleep, that may be an indicator for you to discuss that with your clinician at the next visit. So like Bree is sharing, there's different buckets that come from the Apple Health Kit versus what comes from that movement disorder kit from the watch, and then everything that is self-reported, like saying that you took a medication, or logging that you've had a fall due to, tripping over something. Or if you want to log a specific workout, like an LSVT big workout or rock steady boxing, you can manually input that as well.
Well, thank you for sharing that recap, because you guys have so much that you offer. I don't know if there's any other questions, but I want to thank you so much to both of you for joining us today and sharing this incredible product, but also this Guardian, like the additional options with the Guardian. So I know we dropped links in the chat, everyone. If you want to go to your little dots and save your chat, that way you can grab all of those things that have been dropped in there today by Kelly. And I want to thank both of you for being a part of this today.
Yeah, and we want to thank you guys too. We would love to send you a 50% off Guardian subscription. We feel like this is something very important. We don't want costs to get in the way. So if you feel like Guardian is something that you're really interested in, we do have a limited time 50% off code that we would love to get to you, Anissa, to email out with our PowerPoint.
Awesome. Wonderful. That is very generous. Well, thank you so much. And I wanted to invite everyone to give their gratitude and thanks to you by giving you the wave instead of the clap from across the miles, from wherever everybody is joining us from. Thank you so much.